Hi y'all. So 5 pregnancy warning signs. I'm Dr. Fatuforna. I'm an OBGYN who works to keep pregnant women safe here in the US and around the world. So there are some pregnancy warning signs where if you have them, you need to talk to your doctor and make sure everything's okay, because it might mean that you have a problem with your pregnancy that you need to be seen. A lot of times, if we see you early enough, we can stop a lot of these problems. We can diagnose them, we can treat them, we can make sure that you and your baby are safe. So if you have these warning signs, contact your doctor or midwife immediately. Of course, we all know about the general warning signs. If you have chest pain, you have shortness of breath, you're fainting, whether or not you're pregnant, those are warning signs that you need to talk to your doctor about. But these 5 warning signs that I'm going to talk about are pregnancy specific. All right. Number 1, contractions. If you are full term over 37 weeks, yes, we want contractions. That's what you need to go into labor. So this is not for you. If you're over 37 weeks or more, you're full term. Bring on the contractions. I know you're probably tired of being pregnant, so you're happy about that. However, if you are less than 37 weeks, you are considered preterm, especially less than 35 weeks. That's really preterm. We need to try to stop you if you're going into labor. So if you're preterm and you have more than 4 contractions in an hour, it's probably a good sign, a good time to call your doctor and let them know I'm having contractions, especially if they're painful, they're not going away. It might be a sign of preterm labor, and we might need to see you so we can stop that and just nip that in the bud before it gets worse. All right, you might be dehydrated, something else might be going on. We need to fix it. All right. Number 2, vaginal bleeding. Any heavy bleeding like a period when you're pregnant is not normal. You should never bleed heavily like a period. If you do, contact your doctor so we can figure out what's going on. If you're pregnant and you're bleeding heavily, blood's running down your legs, that's a 911 call, because we need you to get to the hospital. All right. Spotting, if you're less than 37 weeks and you have spotting or bleeding, even if it's light, that's not normal either. We need to take a look at you and figure out what's going on. Spotting might mean that you're starting to go into premature labor, that your cervix is dilating. We need to stop that. So any spotting less than 37 weeks, any kind of spotting or bleeding is not normal. Definitely heavy bleeding like a period anytime, even if you're over 37 weeks, even if you're full term, you should not have heavy bleeding like a period. That's a warning sign. Number 3, if you lose fluid, loss of fluid from your vagina, you all of a sudden you're walking around and there's a whole big gush of fluid, or it might not be a big gush, it might be a trickle, but it's a trickle that keeps coming and it's not stopping, and your underwear is wet. Now, pregnant women, we might have a little leakage when we're pregnant of urine. You cough, you sneeze, your underwear gets a little wet. That's not what I'm talking about. But if your underwear is getting soaked and water's running down your legs, or you were never really having losing urine before, but your underwear starts getting wet all of a sudden, get it checked out. Talk to your doctor about it so they can check to make sure your water is not broken. Because breaking your water early could put you into premature labor. Also, if you're preterm, you break your water early, we just need you in the hospital. Even if you're term, you break your water. If you're full term, you need to come into the hospital. So breaking your water is a reason to contact your doctor or midwife. Number 4, if your baby is not moving. We need these babies to move. If you're over 20 weeks, you start feeling the baby move. And with time, the baby gets stronger. By the time you're about 28 weeks, your baby's kicking you, elbowing you. I know sometimes it hurts. It's a little uncomfortable, but it reassures you. It tells you that my baby's okay, my baby's doing fine. When babies do not move, it's a sign that they are stressed out. Something's going on. Maybe their cord's tight, really tight around their neck. Maybe their placenta is not functioning, so they're not getting the nutrients that they're supposed to. Maybe they don't have enough fluid around themselves. It just means that something's wrong. Your doctor will probably talk to you about something called kick counts. Kick counts are where we count the number of the baby's kicks. We usually recommend it, if you're over 24 weeks or so, that you're doing kick counts, twice a day, one in the morning, one in the evening. It's really just to check and reassure that the baby is okay. For kick counts, we usually recommend that you count 10 movements. You should get about 10 movements in an hour. If it's been an hour and you have not had 10 movements, then eat something, drink water, lie down, and count again. You should get your 10 movements. If it's been 2 hours and you do not have 10 movements, then that's a problem. Because sometimes babies sleep, but if you've given it about 2 hours, baby should be moving around by that time. So if that's not happening, call your doctor. They typically want to see you and check on the baby and make sure everything's okay. We do not want you to go a day, 2 days without the baby moving. That's a problem. And we see that happening sometimes, and unfortunately the baby has died. We want you to come immediately when there's a problem, because we can put you on the monitor, we can see if there's a problem with the baby, and if there's a problem, we can intervene, deliver the baby early if we need to prevent the baby dying. All right, number 5, pregnancy warning sign is a headache. Especially if the headache is persistent, you're taking Tylenol, it's not going away, especially if it's severe, especially if it's coming with other signs. You're swelling your face, your hands, visual changes, blurred vision, seeing stars, or you have pain in your right upper quadrant where your liver is. Those could all be signs of preeclampsia, that hypertensive complication of pregnancy. That's one of our major killers. So if you have a headache and on any of those associated signs, contact your doctor. So Black women, pay attention to all of these warning signs. Seek help immediately if you have them, because we need you to survive and thrive.